here and clearing out. Here's Fox 2's Ingrid Kelly.
As the COVID-19 crisis peaked in Detroit, a field hospital was created at the TCF Center for less severe patients in an effort to take pressure off Metro Detroit hospitals dealing with more dire cases.
As the influx of patients didn't peak thankfully, it didn't peak like we expected it. The state started looking at it and saying, all right, what can we do for cost containment? And what can we do to save the taxpayers some money?
Volunteers make up the Civil Air Patrol, which is part of the United States Air Force. These volunteers were initially brought in to help manage the staff at the hospital, but now these volunteers are helping it enter its new phase.
The Civil Air Patrol had a team of people in here that started planning the demobilization process. We discharged our last patient 9 days ago. We had to wait for the environment to be safe for us to go in and clean it up. We've put in what we call a make safe category.
It doesn't mean the makeshift hospital is shutting down. Instead, it's on guard. Members of the Civil Air Patrol say they are leaving on Friday, but if their services are needed, they can be up and running in a heartbeat.
All the linens are changed out, all the supplies are set up so that with about a 48-hour notice, we can repopulate this facility with doctors, nurses, and medical staff.
The efforts of the Civil Air Patrol volunteers also an added bonus as the volunteers help the state preserve its finances as it responds to the crisis.
They brought us in not knowing that we were essentially a cost-free asset for them to work with, but they really brought us in for the skills. Over the month and a half that this facility has been up and running, we've had over 1,000 people staffing various levels.
In Detroit, Ingrid Kelly, Fox 2 News.